So one of the things that we were asked for at a very early stage was to start producing dashboards around COVID. They cover all of northeast, northwest and southeast London. And we can break that data down so that figures can be produced both at borough level, so Tower Hamlets versus Newham versus Barking and Havering, down to the primary care networks, which is one level lower than that, and then right down to individual practice level, so that we can see what's happening within one practice against another. Because in the first wave, there was no testing. Our testing was very restricted because tests weren't there really. So we were able to chart GP suspected diagnoses. And out of that, we produced from Queen Mary one of the earliest papers that demonstrated the ethnic differences in how people were being affected by COVID. And it showed us that our data on suspected COVID gave an earlier indication of how the epidemic was rising in the first wave before the data on deaths started to come through. Now we've got adequate testing capacity and tests are being done at the drop of a hat. We can also plot the testing that's being done, and of those who are tested, who is positive. And because from general practice, we know how many people there are registered in particular ethnicities and in particular age groups, we can compare the rates of test positivity in the different ethnic groups. And again, we can demonstrate how South Asians are testing positive at a much higher rate than the white population. And we can produce more accurate data on deaths now and show that South Asians are dying still in the second wave in Tower Hamlets, the borough in which I work, at 3 times the rate of the white population. And that level of inequity is obviously something that we're trying to address. It was quite alarming when we started to see in our data that South Asian and black populations had far more vaccine hesitancy, and that in the particular tiers of age bands were coming forward much less than the white population for immunising. If you take, say, the over 80 cohort, 71% of the white population were being immunised, half that, 37% for the South Asian, and the black population was much lower, 26% only. And once our local GPs and vaccination centres were alerted to that, extra effort could be made to bring in those populations. So we were able to target videos that we could circulate through WhatsApp and social media around the different ethnic groups. We were able to put a pop-up clinic in the East London Mosque to target immunisations. We could work with those religious communities, the imams and so on, so that they could endorse the vaccine, allay fears that this was not haram, that it was all halal to have your vaccination done and so on. And so we've improved now.